like, comment, and share our page both in Facebook and on YouTube channel. Welcome and God bless you. This evening we'll be talking about the topic halitosis. Halitosis is a very interesting topic, and I'm sure every one of us is going to benefit from it, and you will learn one or two things. That's why with me here today I have Dr. Amaka Nemene. Sorry, I hope I pronounced it well. Okay, thank you so much for coming. We really appreciate you being our midst this evening. Halitosis is a medical term for bad breath. If you have ever heard it before, please don't panic and just be at rest, because it is not that bad. About 1 in 15 general population in the society are suffering from this condition. And even those that think they have halitosis, they actually don't have it. But this evening, for you to have more knowledge about what halitosis means, I would like to ask Dr. Amaka, please, halitosis, can you please tell us what halitosis is all about?
Okay. Thank you. Good evening, viewers. Thank you for having me today. Like you said earlier, halitosis is a very, very interesting topic and fairly common. It's a condition whereby a person emanates foul, unattractive odor from the mouth, and is generally called bad breath in the layman's language.
Okay.
It can also be called fetor oris, which is also the same thing as halitosis.
Okay.
And taking the statistics, like you earlier said, it occurs in about 25% of the population generally.
Okay.
Apart from dental caries and gum disease, what we call periodontal disease, is the third most common condition that patients come to the clinic complaining about. Okay? The most common cause of halitosis is bad oral hygiene. It's a fairly, we would say comparatively, is a minor medical condition.
Okay.
But it can cause a lot of psychological distress.
Of course.
It has a lot of psychological distress attached to it. And then it causes some significant amount of worry to the individuals that present with it. It also causes an embarrassment and anxiety to an extent. And it also has a bit of social handicap to the person that is presenting with the condition. For example, where I work, I normally interact mostly with students and staff. Some students come in complaining that they feel rejected when they talk and people draw away from them. Okay? So, in fact, to an extent, it has even affected some of their studies, the work they do, because their self-esteem is low, their confidence is low. They find themselves secluding themselves. They don't want to associate with others just because they have this condition. We also have another group of people, spouses, husband and wife. That one is a different kettle of fish altogether.
Yes.
Okay, because we've had several very serious cases that come in to the clinic presenting that. Okay. Now, what happens when you have halitosis? When food particles collect in the mouth and is not washed away or brushed off, the bacteria that is the normal flora, what we call the normal flora, that means these bacteria are resident in our mouth. It's normal.
Okay.
Okay, but when you give them an optimum condition, they begin to work. They break down the food particles, produce sulfur-like smelling compounds, and before you know it, it starts oozing like that. Okay, there are several causes, but let me stop here for now.
Okay, thank you so much. As we know, halitosis, as she has said, is also known as bad breath. And bad breath has to do with the bacteria that is multiplied in our mouth. Ma, please, can you tell us the causes? There should be some particular thing that actually cause this condition, bad breath.
Yes, there are causes. But before we go into the causes, I want us to look at the diagnosis. How are we sure it's there?
Okay.
How are we sure it's there? There are 3 ways we could do it, 3 or 4. The first one is that you could ask a friend or a relative. But most times, I've not seen husband asking wife or wife asking husband.
Of course.
That one is.
In fact, they feel embarrassed.
Okay, so you could ask a friend and say, please, do you notice any abnormal smell in my mouth? Or if a good and a candid friend will tell you.
That will be difficult.
Okay? A good and a candid friend will, no, they will tell you the truth, or a relative. Or you could do it subjectively. What do I mean by that? You lick your wrist, okay? This inner part of your hand, and then leave it to dry. After drying, then just smell it and see whether you like what you're smelling there.
Or not.
If you don't, then you have diagnosed it yourself that you have halitosis, okay? You could also present yourself to the dental clinic where you could see a professional. People like us were there to help you diagnose whether you have it or not. Okay, we could do it. It could be mild, it could be moderate, it could be severe. But once it's there, it's there.
It's there.
Okay, there are other more sophisticated means of knowing whether that is rating the halitosis. Okay, but we won't go into that. Okay. Like enzyme test and the halimeter and all that.
Okay.
But we won't go into that. So we will now go to the causes. We could group the causes in three categories. The first has to do with oral issues. In fact, 80% of the causes has been related to the oral issues.
Okay.
And that is bad dental hygiene. Okay? When we're talking about dental hygiene, what do we mean? Some people don't clean their teeth. People will not believe it, but it's true. Some people don't brush. And the ones that brush, I don't know, they'll just brush under 30 seconds is too much.
No,
they are finished brushing.
They can even let me skip today, since at least I can brush tomorrow.
Okay? So not brushing your teeth well, then not cleaning your tongue. Now, I was amazed that some people came and didn't know that they are supposed to clean their tongue. Yes, I've had people like that.
Wow.
And the ones that now clean, they just clean the front, what we call the anterior one-third of their tongue. Meanwhile, the bacteria are laden and covered at the posterior end. So you find out that after doing that, they still present with the same condition. Okay, then there's this thing we call flossing. It's fairly common now. Flossing, dental flossing, you clean in between your teeth, because we know that at times, most times when we eat, we have food in between our teeth. In between, so we need to floss. So it's a thread-like piece of, what do I call it now?
Floss.
A piece, yes, that we use to clean in between the teeth. It's called dental floss. So apart from that, we also have other oral issues. What we call cavities. Cavities is dental caries. That is holes. You see people come and tell you, oh, I have a hole, I have holes.
In my mouth.
That's what we call cavities. Cavities have the ability to harbor food that you have eaten for more than, will I say, months. They are just lodged in there, and the bacteria is having a field day there. So no matter how they brush, you find out that those people still present with some degree of unattractive odor. Then we'll have people who come disease.
Before you continue, can you tell us, is there any difference between brushing and flossing?
Yes, there's a difference. You use a toothbrush to brush, then you use a dental floss to floss. Brushing has to do with your cleaning the surfaces of your teeth, both the biting surfaces, the occlusal, the labial, what we call the labial, and all that. But flossing has to do with cleaning in between your teeth. Okay, when we use the dental floss, deliberately use it to clean in between the teeth, because after brushing you could still have food stuck in between your
Your
teeth.
teeth.
And the bacteria we have in our mouth will still be there to act on them and produce odor.
You know,
okay?
sometimes we think flossing means picking, like picking teeth. Is
okay,
it?
okay, the typical dental floss has a peak end.
Okay. Okay.
Okay, if you look at the prefabricated ones, it has a peak end. So that peak end is not what we're talking about. It's the other end that looks like a saw. Okay, that's what you use. You press it down to your gum, then bring it out. Whatever is in between your teeth comes out. But that peak end, you could use it to clean the anterior, that is the front of your teeth.
Okay.
You know why? Because if you use that peak end for your posterior, that is for the ones inside, you could create what we call pockets.
Okay. Okay.
Pocket is a space that is between your gum and your tooth. And what happens when you have a pocket? Food packs in there.
Okay.
As food particles pack in there, the bacteria become more active. They are happy, they are joyful, they
Of
begin
course.
to act. Okay? So by the time you pick, you find out that it expands more. It's a vicious circle. Then more food particles will go in. It continues to act and smell comes and all that. So we
Okay.
always advise, don't use people are so used to using toothpick or toothpick. Don't use toothpick. It's prohibited in the
Okay.
dental circle. Don't use toothpick.
Okay.
Use dental floss.
Floss.
Okay.
Okay. All
So
right.
that it will help us to also prevent gum diseases.
Okay.
Okay, that's just the oral part. The second cause that we're talking about is what we call diet and habits.
Okay.
What do we take? If we take sugary substances, okay, we'll find out that when you take sugary substances, the bacteria that are in your mouth, they are very active. Okay?
Yes.
For example, refined carbohydrate, bread, biscuits, you understand? They just stick on your teeth like that. And if it stays there for some time, as short as 10, 15, or even less now, okay, they act on it, produce harmful acids that begin to eat up the teeth gradually, and that. It also happens in the pocket, creates hold and makes it very, very hurting.
Okay.
Okay, now, what do I mean by habits? People that smoke, tobacco intake, okay? Tobacco causes, if we are sincere, if you meet a smoker, no matter how much mint or tom-tom they take, once you talk to the person, you know that the person has smoked because they have a very peculiar smell.
Wow.
Okay? Then we have food like garlic, like onions. So those ones are absorbed into the bloodstream and they now come out through our breath. So by the time you talk, it comes out like that. And then the person has that. Those are the diet and the habit. Then we also have issues that have to do with dry mouth.
Okay.
What we call xerostomia. Whereby if you have dry mouth, our normal bacteria that is supposed to will become very active.
Yeah.
And produce smell. That's why you notice during fasting, if you're sincere, you find out that your mouth smells more during fasting. Isn't it
Yes,
so?
of course.
Yeah,
Of course.
It smells more. Then we also have some medications that also causes dry mouth. Okay, those ones are also there. You know, at times when students come and tell me that their mouth, I ask what time of the day, what did you do, what were you not doing? So people will tell you it's after I finish reading for a long time. Then when I open my mouth, the person close to me runs away. I said yes.
Smells.
Because when you close your mouth, you are not talking. The salivary flow is very, very slow.
Of course.
So once it's slow, what happens? The bacteria get more active. Okay, so what do I advise them? Okay, we'll come to the remedy. Then the third cause, we have medical conditions. These ones are a bit more serious. Okay, so you have, like I said, some drugs you take causes dry mouth, causes mouth odor. Then when you have mouth infections, like if you've had a tooth extraction, okay, if you've had a tooth extraction, you find out that yes, you have a tendency that your mouth is red because you have a clot of blood that helps the healing of the socket is there. So the bacteria acts. When you have wounds in the mouth, when you have sores, it can also cause that. Then when you have nose and throat infections, okay, there are things like little stones that form on the tonsils. Okay, those, what we call stones, then they are covered with a layer of bacteria. So you find out that by the time, it happens mostly in children. When you see their tonsils swollen and all that.
Inflamed.
Okay, inflamed, yes. You find out that when a coat of bacteria settles on it, okay, it happens there. Then at times we've had a few cases whereby you find out that orally there's nothing wrong. But the mother keeps saying this child is having, then we find out that it's a case of a foreign object in the nose, in the nasal cavity, yes.
That causes the
child,
smells.
yes, the child didn't tell the mother, look, I put in something there. And before you knew it, that was when we found out that there was a foreign object. That one also causes smell, especially in little children. So these are the three main causes that are categorized.
Thank you.
Thank
you. Thank you so much. This is really interesting. You know, halitosis, sometimes we just believe that it is something that can come. Probably when you wake up in the morning, you just feel, it's because I've not brushed. And that's all. But we never knew that there is more to it than what we think. So, Ma, please, we know about the causes. Actually, this person has been diagnosed. He or she has halitosis. So how are we going to treat this condition, or even prevent it from occurring, or even how to improve our oral hygiene?
We have various ways we treat and then prevent, okay? But before I talk about the treatment and prevention, there's an aspect of the causes that I skipped, which is disease conditions.
Okay.
We have some disease conditions that can cause some degree of halitosis. We have cases of cancer, liver failure, okay, metabolic diseases like diabetes, mellitus. We can also have that because in such cases, you know, the person cannot use sugar.
Yes.
Okay, in cases of DM, diabetes.
Yes.
So you find out that the fat stores in the body are broken down. That's why you see them losing weight. So when they are broken down, they produce a chemical called ketones through ketoacidosis.
Yes.
So ketones have a very peculiar smell, which may not be pleasant. You know, some of these disease conditions have been diagnosed orally. You know why I said so? Because a patient comes and says, look, this is what I'm feeling, this is what I'm, then you begin to ask questions. Begin to ask questions and you find out, okay, go and do your fasting blood sugar, and boom, the person knows that he's a diabetic patient just by coming to the dental clinic. Okay? And we also have some funny ones, like couples. I had a particular one. I will share this with us. The woman came and did what we call scaling and polishing. This is the cleaning we do in the dental clinic.
Okay.
And then after the cleaning, I noticed she was reluctant going. I said, Madam, any problem? She said, please, please, please. I want my husband to come and do this. I said, why? He said, because I cannot stand it.
Wow. That's bad.
And I don't know how to tell him. So honestly, it was a very serious something. So Anna said, okay. She now said she will pretend that she too, she's coming to do so that it will be two of them. Meanwhile, she has done her own. So when she came, she kept on calling me, making sure that the appointment will be kept until we treated the husband. And she came thanking me, say, you don't know the problem you solved for me. So it happens. If we come routinely, we can even, from the medical condition, from the halitosis we could perceive. If we go in details, there are different characters of smell. You have fruity smell, you have like people with bowel obstruction. Okay, they have this feces-like smell, okay, that comes from like that. There are so many other, even the lungs and everything. Wow. Aspiration, pneumonia, and so many of them. So we'll talk about the treatment and the prevention. Then when we're talking about treatment now, the first thing about treatment is that we should reevaluate our basic oral care routine. That is number one.
Okay.
You know why? Because 80% of the reason why we have halitosis is oral issues.
Of course.
So let's start from there. Basic oral routine. I have a very, very senior learned person that came to the clinic. I tell you the truth. If we are to do cleaning, it will take like 2 or 3 visits to tell you the extent.
Wow.
Okay? They were in layers. Well, he told me, he said, I don't have any pain. I don't have any oral issues. It's just because somewhere here was I just said, let me come and check. I said, sir, you need to do scaling and polish. And I just imagine what the wife would be suffering in the house. You understand? It was terrible. So reevaluate your basic oral care routine. What do I mean by that? Maintain a good oral hygiene. Okay? How do you maintain a good oral hygiene? You take care, make sure that you don't have holes. But how do you know you don't have holes? You cannot establish them yourself. So you need to come to the dental clinic. You visit your dentist for a checkup and for cleaning twice yearly. If I were to ask, no, there's no way I can communicate with the audience. But if I were to ask, I would say, how many people, some people will tell you for life we've not done that.
Even I have not done that. I won't lie.
You are confessing.
It's true.
So you have to visit your dentist and do cleaning twice a year. Use a good toothpaste. The toothpaste we find in the market, most of them are
Yes,
good.
yes,
Most of them are
yes.
good. It's only the herbals we don't know what exactly is inside, but they are good. Most of them are good. Then you treat any gum disease and prevent, any kind of bacterial buildup. You know why gum diseases are very, very important? Because I think apart from having holes in the teeth, they create the most favorable environment for bacterial buildup. So how will you know you have a gum disease if you don't go visit the dental clinic? So it's still basically visit the clinic and have yourself checked up. Okay, there's this, when you wake up in the morning, if you run your finger across your teeth, you feel something slimy. It's called plaque. And when you have plaque, when you have plaque which accumulates overnight, is a thin film of a slimy substance. It harbors a lot of bacteria.
Okay.
So that's why we brush.
Okay.
But over time, no matter how you brush, it keeps there's some degree of deposit over time. By the time it deposits, it causes hard what we call calculus. That's the name we call it. Hard deposit.
Okay.
All around the gum, all around the teeth. You find some under the gum. When it deposits initially, it's creamish color and it harbors a lot of bacteria.
Yeah.
Okay. Then you see the ones that have stayed for years, they are greenish and they are in layers.
Wow.
Okay, those things too. When you come for cleaning, they are taken care of.
Okay.
At least when we maintain a good oral hygiene. That we at least we are eliminated the 80%, and we're now looking at the remaining 20%. Okay. So any other underlying medical condition that presents itself, we can now keep it under, but we are sure that our mouth is clean.
Okay.
Now, how do we prevent halitosis? How do we prevent halitosis? First and foremost, we brush twice daily. I wish I could demonstrate brushing, how to brush, because there's a way to brush and there's a way not to brush. Okay? Most of us brush across like that, but it's not supposed to be. You are supposed, first and foremost, the choice of your brush is very, very important.
Okay.
The choice of your brush is very, very important. You should get a brush that has a long handle and a small head. You know why? So that it can get into the nook and the crannies, especially the upper and the lower parts, those corners. If you have a brush with a big head, it will not get to those corners. Okay, so brush twice daily and floss after every meal.
Okay.
It's very important. See, flossing can be clumsy when you start initially, but I have to encourage you, do it. Learn it. By the time you learn it, you become used to it. Even outside, if you eat out, you can floss. Okay?
Sorry, before you go further, speaking about brushing, is there, I have seen some people that they say they like hard brush, like choice of brush. Some prefer soft brush, some prefer hard brush. So what will you advise in our choice of brush, the one that will be more beneficial
Okay.
for us.
Professionally, we advise you use a medium texture.
Okay?
Okay? And then don't brush as if you're clearing a gutter.
In fact,
Okay? Brush gently. Okay? You brush with a twist. You open your mouth slightly, then with it, make sure your wrist is twisting up, from up down, from
Okay.
down up.
okay.
Okay? Now, you are advised to change your brush every 2 to 3 months. Some people use brushes for 10 years.
In fact,
They have not changed
that's,
the brush.
that's the
That
issue.
alone too harbors some degree of bacteria. I
Wow.
must tell you.
Wow. Wow.
Change your brush at 2 to 3 months. 3 months. Change your, so at least you should use 4 toothbrushes in a year.
Wow. In this economy.
Yes. Yes.
Okay.
4 times in a year. Brush your change your toothbrushes, and then you floss.
Okay.
You can get floss in a pharmacy or supermarket. They are easily available now. Okay, now the next thing again you should do is to clean your tongue. There's actually a tongue cleaner, but it's not very common. Yes, you have a tongue cleaner whereby you just use it, so it gets to the posterior part of your tongue. Okay, and then you clean on the tongue is supposed to be pinkish, but you see some people's tongue that they are layered whitish, you understand, because of the layers there. And you can imagine what is happening there in terms of bacterial growth. Okay. Now when you're talking about cleaning the tongue, it's very, very important because of the wide surface. It tends to accumulate a lot of, and some people don't know that they are to clean
Their tongue.
their tongue. So cleaning of tongue, if you don't have a tongue cleaner, you can use brush. But let me tell you how you get to the area. By the time you clean your tongue with your brush, until you do as if you want to retch, you are getting to that place now.
Okay.
You understand what I'm saying?
Yeah.
So you put it behind, and then it's like, oh, you want to retch, that kind of way. Yeah, you're getting there. So you use that. Clean your tongue. Okay. Then keep your sinuses, your nose. If you are having anything, issues with that is recurrent catarrh, like that, you go for a medical check and see. So make sure that your nose and your sinuses are clean, because the sinuses is another place where you have mucus, and then you have heavy bacterial growth there, and it smells too. Okay. Then you have to, in order to make your saliva flow better, okay, you take fruits. Take fibrous fruit, take carrots, take chew raw. It helps to stimulate salivary flow.
Okay.
But I work around students, so at times they will tell you they can't buy food. I say, okay, go and look for Orbit chewing gum that has no sugar. Then I say 1 packet will do you for the whole semester. Do it like this. Bring 1, share it into 3. So that they won't say that the money is not there. Okay. Then chew as you're reading, and then it helps your saliva, okay, to flow better. Then talk about drinking water, at least 8 glasses of water. It keeps you rehydrated.
Okay.
It keeps you hydrated. It keeps you hydrated and keeps you going, because a dry mouth encourages mouth odor. So you can now understand that during fasting, why mouth smell more than, you understand, the ordinary other times. Okay. Then ask your doctor if there are any medications that cause dry mouth too.
Okay.
So that you'll be aware of it and now know what to do. If it can be changed, the medications will be changed. If not, then you know how to go about it. Then another thing that is commonly found in the house is warm water and salt. Everybody can afford warm water and salt.
Okay.
Instead of going to buy those expensive mouthwashes,
Yes.
you make your own warm water mouthwash, warm saline mouthwash. That's what we call it. Okay. Now, the warm saline mouthwash, you get a cup of warm water. A cup of warm water, teaspoon of salt. You level it, mix, then use it to gargle, use it to rinse. Number 1, it helps your gums very well. It helps to promote the healing of the gums. That's what we tell patients after extraction. It helps healing. Okay?
Okay.
So those are things we can do to prevent halitosis.
Okay. Thank you so much. This is really interesting, and I'm really enjoying this topic. Thank you, ma. We really appreciate you for that enlightenment. Well, another question is that, does improper cleaning of dentures aid halitosis?
In fact, it was an omission, because I had it in mind to say, but yes, in fact, heavily so. Okay? What or artificial teeth? We have different types of artificial. The denture is the removable one. Okay? You remove it and put, you remove and put. It's a potential source of bacterial buildup. But if you follow the instructions regarding using of the denture,
Okay.
it helps prevent all that. What do I mean by that? After the denture has been fixed, you are told every night get a cup of water, remove it,
Put it inside.
Okay? In the morning, use, if not the brush you are using, use maybe a spare brush. You brush it very well, rinse it, and
Inside
replace it. But, my dear listeners, some people don't remove their denture from the first day they fix it.
Yes.
Till probably they have a problem.
That's
And
it.
then when they come, you are looking for the denture. You know why? Because it's covered with a heavy coat of calculus.
Wow. Wow.
You can only imagine the odor that comes. You can only imagine it. You don't even need to perceive it, just imagine it.
Wow.
It's so bad. Okay? They so get used to it, they don't remove it as instructed. So it keeps accumulating. In fact, the way the dentures are done, there's a denture cleaning tablet. We have denture cleaning tablets, which you are required to use, I think, if I'm right, once every month. That's apart from the normal cleaning. You get the denture cleaning tablet, you get a bowl of water,
Okay.
put the denture there, put the tablet there, it does effervescence. By the time it rises, the whole thing dissolves in the water. Then you leave it there for 15 minutes.
Okay.
After 15 minutes, you bring it out, clean and rinse. So now imagine improper cleaning, improper care of the denture. Yes, it happens.
Thank you so much
Yes,
for that.
it happens.
Well, as you were talking, something came to my mind. I want to ask, in a scenario whereby, okay, let me give example, like every morning, okay, let me not say every morning, sometimes when my kids wake up, let me give example with my kids. On weekends, probably they wake up from sleep and they were using phone probably to watch cartoon, even before you ask them to do anything. And the younger one is on the phone. The sister comes around and say, "What are you doing?" You know, if we just said, "Please move away, your breath smells." You understand? You know that kind of thing. So when he says that, even me, I feel embarrassed. Talk more of she will not say, "How will you say my breath smells?" So peradventure, you come across people with halitosis around you, or probably you don't know them, but immediately they move close to you. They may not know, but they move close to you. You were like, this person's. So how do I meet or approach such individual in a manner that the person will not feel embarrassed, that I can easily tell him, please.
Okay. This question is very, very subjective. Okay. You know, some people, you talk to them, they even thank you. Others, they go
Get
aggressive.
angry, yes.
Okay. Now, for your children that you gave example, when you wake up in the morning, you expect that your mouth will smell. It's normal.
Of course.
It's normal. Although some people have more, and maybe the person opens the mouth when he's sleeping, so the mouth is drier than the other person that closes. Okay, people that snore too, like I said earlier.
Okay.
Okay, if you snore with an open mouth, your mouth feels dry in the morning. Probably your daughter is not snoring, but maybe opens mouth when sleeping, and your son doesn't. So probably that's why the smell in her hair. Since you wake up in the morning, you are expected that, yes, your mouth should smell.
Of course.
You understand? Although at times, if you sleep late and you brush very well, clean your tongue, when you wake up in the morning, you can hardly even smell anything. Okay? Now, for issues of approaching people with halitosis, You understand? They are, depending on, if I were advice, I would say, okay, if you are close enough to the person, you could, not in an embarrassing way. Already it's embarrassing. Not in embarrassing way. Don't say where people are.
Yes.
Okay, maybe you call the person aside and say, please, I think maybe you should go and see the dentist. I said, why are you telling me you go and say? I think you should go because it's like your mouth smells a little bit more than others. Don't say your mouth stinks. You know that brush like that.
So that you won't get slapped at the end of your.
Okay. Now, that's the issue I was telling you about. It's more difficult between spouses, depending on their levels of communication. The ones that communicate well, honestly, no problem. You find, wait till you chop. You understand that kind of, you can easily pass across the message. But the ones that their level of communication is low, now talk of war. If you talk you are in trouble. So that's how they'll be going round, like that one that ran to me and he called me how many times? Make sure you fix appointment, make sure, because she couldn't get to tell the person. So if you meet somebody with, number one is that don't be rash. Okay? If you think you are not close enough, look for somebody who is close enough, or a relative, or if you know someone close enough to him or her to be able to pass across that message. After all, you want to help the person, okay? Don't expect the person when you just come in front of everybody and say, your mouth stinks. Then you say, oh, thank you. No, nobody will accept that.
Of course.
Okay. So please, that's what I will advise.
Thank you so much, ma. This is really a very wonderful topic today, and we really appreciate you. Thank you so much. Halitosis is characterized by an unpleasant odor of the mouth. The causes of halitosis include food tuberculosis, even poor dental hygiene, even some medications, as she have said, they are causes of halitosis. On account of this, some people feel embarrassed, even stigmatized, humiliated because of this condition in the society. So I believe today, with what we have had, we will be able to take care of our oral hygiene in order to prevent embarrassment from other people. So with this, we want to come to the end of this edition, and we want to say thank you so much to all our viewers. Thank you for being with us. We want you to at least share, like, and comment on our page, both on Facebook and on YouTube channel. I believe we have learned a lot, and also join us the same time next week in our physical gathering and our online gathering too. God bless you. Thank you so much.